Good morning, Dr. Durga. It's a
Good morning,
pleasure to
Arun.
have it's a
Thank
pleasure
you.
to have you here.
Thank you.
So,
Same here.
as I explained previously, this is a recording that we do, a conversation we have with several doctors to ask them about professional stress that they have experienced in their career. So, I'll introduce you initially. You are Dr. Durga Reddy. You're a surgeon, one of those rarer, women surgeons. And then you're not training to become a plastic and reconstructive surgeon. So you're doing your MCH at the Amrita Institute in Kochi. So, Durga, as we were speaking earlier, have you experienced professional stress, and how did you cope with it?
Yeah. Yeah. Coming to that, professional stress, I think every profession experiences. But in the thing is that in doctors, we'll be asking patients like, how are you and all. And yeah, we'll be worried about them. Are they okay? Do they have fever today? How are they doing? And like that, no one asks us because I don't know, somehow it's like in a rush, the whole day goes on. So even if you feel tired or you want to take a leave because of the scarcity of doctors or residents, most of the times you might not be able to take. So if you get a fever, instead of taking a paracetamol and just trying to push yourself, in a normal profession, you just take a leave, day off, and just uh, let your body do some exercise, de-stress itself, and just you come back to work next day. In doctors, the thing is that you push your body to an extent where there is like you're just putting more, like you're giving a turbo engine to a normal engine, you replace it, and you do that kind of thing to your body so that you just work.
That's
So
not true, Durga.
yeah,
Is that how you
yeah.
work as a surgeon?
So most of them work like that. Probably in India, I don't know out of the country how it is, but here it is like this. So even if you're tired or sick, because you cannot afford to take leave like 2 3 days continuously, because your other colleague will be overworked. They will fall sick. It's like a chain reaction. So that is the thing.
So, Durga, I'd
Yeah.
like to ask you, as a lady surgeon, you know,
Yeah.
women surgeons experience different types of stresses.
Hmm.
Have you experienced?
So yes, yes. I think probably everyone experiences, but rarely they speak out, is what I feel. See, uh, there are many incidents, but I would like to recall one because it is like uh, probably it would have changed my life if someone would not have helped me at the right time when things were going very bad. So I'm doing my residency, and yeah, residency itself is stress first thing. And there is one such person who is going on saying bad words. It started with bad words. Okay, it started with bad words, and they were like, yeah. Uh, Initially, we are with our colleagues, and the other person, the other doctor, is asking us few questions, and we were answering. And suddenly, he said a bad word, a very very bad word. I would like to mention that specifically. Very bad word that you do not usually address a woman like that. And you're not talking to a layman. You're talking to a female doctor in such a way. Okay, I was in tears. I looked at my another colleagues, and I could not get any support from them to exactly mean that. And even then, thing is that if something like that happens, we have to stand up for ourselves and just say, just to stop the other person. But because this person is a big person, I could not say anything to that person. Or so things like that slowly progressed. And it went to such an extent, the words, the bad words, the things that are happening. There is no physical abuse. Okay. The words, the bad words, the things that are going on are going so bad that one night, I called my other colleague, my friend, my male colleague, who is my friend. I called him and told him that I cannot take this anymore. And I'm fine with just an MBBS degree. I don't want to finish this degree in this much horrible situation that I'm facing. And I don't want to do this. I'm leaving home. Then he's like, don't go in the midnight. You can go early morning. I will drop you. Don't take any rash decisions till then. Let us just talk out things and we'll just figure out some solution for that. And he came and he picked me up early in the morning, and I just left home with my things. I packed my stuff and left. I'm not even joking.
So, Durga, just to
And
clarify, this is not in the current position. It's
no,
in
no.
previous.
This is not in the current. This is not at all in the current hospital, because I joined this hospital especially for this one thing, where there is the females. They might be anything. They might be a person who is working as a clerical post or a doctor post or whatever post. They're treated with respect. My parents did all that check, and they got me into this hospital, I mean, this college, because this is a college. Amrita is one institution where females, no one, I mean, that highest level of respect they give to a female in this hospital. So not in the current hospital, not at all. In that way, I'm way more lucky to say that. And yeah, it was in a previous hospital and institution where I previously studied. And yeah, that things happened and I have left home. My parents are also helpless because yeah, they are normal people. They could not go on head on with this kind of situation. They don't know how to even help me. They are like, okay, just don't study or take a break, or you can do it after 3 years or whatever. They were saying all these things. And then my friends called, they were like, just come back. We'll find a solution. We'll be there with you. We don't know that this much is happening because you never told. What we know is the tip of the iceberg. It's not the what is underneath is until the other person tells you, you never know. So the same thing happened. I went back and they actually stood with me because they came to know what I'm going through and other female doctors are going through, and they stood with me. And yeah, that is how I survived, just because I spoke about that problem to they're not even my friends then. I thought they're also bad people. You just come to a conclusion where if bad incident happens, when some person is doing this thing to you, you go into a depression kind of thing. And that's how depression is, I think, no? You
Yes.
think everything is going to go wrong. You
Yes.
will be totally negative. So I'm like, oh, these people are also like this. They don't care about what I am going through because they are not going through this. How will they know? Why will they help?
Mm.
But they helped me a lot. These um, three people, I could give the whole credit to. I would even give my MS degree to them. That's not possible.
So Durga,
Yeah.
just to emphasize, you are not usually a person who is fearful or afraid.
No. I am a very brave person, but these moments, no, they will make you feel very timid.
Mm.
Very timid. It's not like these incidents don't happen like to everybody. They happen.
Right.
Okay, it's how the person takes it, how the person is getting help from others. Are you able to talk it out or not? That is the point, which is the crucial thing, whether you'll be able to come out of it or not.
So important, Durga, that you're saying that, talking about the stress that you experience, even if others are not your friends, if you talk it out, you feel
Yes,
better.
yes,
That's
much
amazing.
better, much better. And I'll tell you, I even took psychiatry treatment for depression after this. Like, then I realized I just need these people. These are my antidepressant pills.
Mm. Yes, yes,
Yeah.
absolutely.
I'm not saying that pills did not help. They helped, but the people were just holding me like, yeah.
Especially to bring you back into the profession, isn't it, Durga?
Yes, yes. I am saying that with 100% truth. I left home saying that I don't want this degree. I am not coming back. But those are the people, the reason I came back and I'm able to finish my degree. Yeah.
That's amazing, Durga. That's amazing. And I think, what you said will inspire people who might face similar situations or are facing similar situations today.
Yes, yes, yes. It's just from the outer appearance, we'll think, this person might not help us. Why will this person should be bothered? He looks very unbothered about normal things only. Why
Mm.
will he get into that situations where even they can be punished or something, right? If they go against something or someone knows that they're helping me or something like that, they will be also in a bad position or some that still they helped me. So, but don't go through outer appearance. There
Mm.
are really good people out there. It's just that you have to open your mouth and say your problem. Sometimes it can be a bad person who might take it to their advantage.
Mm.
That also happened. But there are really good people out there who are willing to help. That is what I wanted to say in this thing mainly.
Thank you so much, Durga. Thank you.
Yeah.
Durga, there's one more question I had of you. So you've had an experience. How has it made you stronger in your profession?
Stronger is that instead of saying stronger, I would say positive. Because initially I was being negative about people.
Mhm.
You understand, like, I'm like, I'll just do my own business and I'll just walk off. I don't want to deal with any person. But once you start seeing a person in a positive way, you will be able to help them, you will be able to receive help. I know it sounds selfish, but it is how a workplace should be. If you are happy in your workplace, that is the best thing. If you are happy with your colleagues, if you are happy with your workplace, it is the best gift, because I think half, more than half, doctors will be in their profession. Uh, I think probably 70%, if I'm not wrong. 24 hours, we'll be like most of the time in the hospital or with the dealing with the patient, or someone from our parents' side, or someone will be calling for the consultations and all those things. You like your half, more than half of your life is in your workplace. If that place is not positive, that's it. That's the end of your mental health. Khatam.
True, Durga. So
That is
how,
what I
how
think.
can a how can a workplace be a happy place? Is it down to you or is it down to the
Yeah,
institution?
it depends on us also. It
Okay.
depends on the other people also. But after coming to Amrita, I realized one thing. Even the highest degree person, the highest, even the boss, the I was like, I feel like a blessing. I I came here and I realized people are like, oh, don't call me sir or ma'am. We are all colleagues. Okay, that's it. That is like, and I thought, okay, this is initial, no? Slowly, we will know. But still, um, it's like even the boss is like, if we give a suggestion or something, they will be like, oh, thank you. Nice thing, nice idea. You don't need a big medal or something then for them to come and put it on your head or in your neck. It's just the positive words. It's just the positive vibe they give you. The respect as a female doctor, the one thing is respect on equal level with your male counterparts. So the thing I feel is that the cortical level equality, it's not a physical equality that I seek in my workplace. It's a cortical equality that I seek on a daily like basis that I get here. I feel respected. I feel good. It it is that kind of thing that you that makes you to want to work more.
Mm.
They are working even more than you, and they're working more positively than you. You cannot be negative in such situations.
Durga, you've said such an important. You're giving us such an important message that it is human beings who can give you stress, and it is human beings who can relieve your stress.
And one more thing, I am not such a positive person, and like these Dr. Jimmy or Dr. Iyer or Sandeep or Dr. Kishore. He's also same name like you, but he's also a consultant and very like these people. Even when I'm talking about them, it gives me immense happiness because after you experience that kind of thing, it's like a luxury upgrade. So these positive people, the thing about the positive people is, they make you be positive. You should be. You feel like it's like an infection. That positivity is like an infection. You feel like, oh, I am diseased. I should become positive like them. Is that is what I used to feel. Even when the negative days also, when I look at these people, I feel that I should be more positive. Even if they're either if they're operating at 12 o'clock, they will be like, they're happy. They're not complaining. That kind of thing. They work for people only like they don't work for money. First thing, they work for the well-being of the patient. They work to make the workplace a happy place. That is the thing. So when you look at these people, no, you feel inspired and you want to stay positive. And here, if something happens in our interruption, any point of time I can go to them and discuss any problem. That kind of confidence and positivity they give you.
That's so
So it
important.
is the people, exactly. It is the people, and also definitely your part. You should not be a bad person and expect others to be good. You should be good. But yeah, if you're good, I think probably.
So thank you, Durga. It's been wonderful speaking to you, and I think you brought out the positivity and how you overcame a difficult situation. Thank you so much.